Welcome back, everyone. Brandon Fischer with us today. He is Allen County's Health Commissioner. By the way, first of all, you just started as
Yes,
congratulations on that.
You.
Yeah, getting your feet wet right away, obviously. Let's talk a little bit about the numbers. We had mentioned that perhaps a few weeks ago we plateaued on this wave of the pandemic, but you had mentioned hospitalizations and death numbers are pretty scary over the last few weeks, huh?
Yes, so it feels like we may have hit our peak,
Sure.
But on our way down, we've gotten stuck at a very high number where our peak may have been 70 to 80 cases a day, and now we're down to 50 to 60 cases a day. And as we start to get into the fall weather, we make our own determination of whether that goes further down or goes back up. And just in this past week, we've had 14 people die from COVID-19, and we still continue to receive death reports from our hospitals. Our hospitals are strained from all the staffing issues that they have, and these patients, when they come into the hospital with COVID, they just have a lot more severe outcomes. They need more patient care, and it's tough on everyone that's working in that healthcare industry. So yeah, the asset we're making to the community is, if you're eligible to get vaccinated, go get vaccinated. If you are in a crowded situation, wear a mask so that you can limit that spread of COVID-19.
Yeah, you guys are still obviously doing the vaccinations, and you kind of had to move to a larger area to accommodate folks.
Yeah, so we rented a space out in Old Elder Beerman at the
Sure.
Lima Mall, and we're offering vaccinations out at that locations on Monday and Fridays from 9 to 3. We have all 3 vaccines out at that site, and people can sign up at gettheshot.coronavirus.ohio.gov to get the vaccine. We're offering first dose, second dose, and booster dose shots to individuals who are eligible to receive that vaccine out there.
Yeah, the booster, we keep waiting for each drug maker to see what they're going to do. It goes through before a panel, and the FDA decides. So you can accommodate that once you hear what the FDA says about it.
Correct. So once we hear what the FDA says about it, once CDC says, yep, you're good to go, we have vaccine stock in our supply that we are able to handle a pretty good influx of people, whether it's a booster shot or once we get under the age of 12, we are preparing to give vaccines out to parents who decide to provide those vaccines to those individuals under the age of 12.
If you go out to Elder Beerman too, get your booster and get a flu shot at the same time, right?
Yes, yes. So that is the added benefit with the flu season, with the strain on the hospitals. If we can get flu shots to people, that reduces the potential influx of patients going into the hospital from flu every year.
I know one of the concerns you had too was the number of younger people under 18 that you've seen in the past few weeks that have gotten it, right?
Yeah, so over the past several months, we've seen the number of people under the age of 18 increase, the percentage of the number of people under 18 with COVID-19 increase. So in our report yesterday, just of cases that have come in from the month of October, we're nearing 25% of our total cases for the month of October being under the age of 18. For people that are going out and getting tested, it's near 1 in 5 are testing positive for COVID-19. So it's not something that's behind us. It's obviously something that we're concerned about, that we want to try to put ourselves in front of that and allow us to continue to have that decline in cases. But until we have that decline, we're still going to see that strain on the healthcare system.
Certainly makes sense. Any thoughts on trick-or-treating and Halloween? I'm sure people will ask you about that all the time.
So trick-or-treating, as long as you're outdoors and moving from home to home, it should be a safe issue. Should be safe.
Sure.
It's a good opportunity to wear a mask when you're out in the public.
Yeah,
and you have that.
Wearing one anyway.
You also have some very short interactions with people, so use hand sanitizer as you see fit. Once you get home, just make sure that you're cleaning yourself up. Keep an eye on symptoms, because COVID symptoms are very similar to flu symptoms and fall allergy symptoms. So. Yeah, if you feel comfortable going out doing trick-or-treating, just keep your interactions brief with everyone, and wear a mask if you're in an extremely crowded situation or indoors.
Yeah, and they can give you guys a holler if they have questions about vaccines and all that kind of good stuff too. Huh?
Correct. You can call us at the health department and we can get them scheduled, or answer as many questions as we're able to answer.
A lot of them out there. All right, thank you, Brandon. We appreciate it. Good seeing you.
Thank you for having me.
Don't go away. More medical news coming up next on Noon Edition.